Welcome to my podcast. Today I'm going to talk you through counseling station. So basically, I'm going to combine two in one. So it's about lesbian, basically, which is means two female in a relationship. So those cases are expected in stations of PLAB 2 examination. So basically, you might come across a patient who is young in age and being distressed, feeling anxious. So you're going to start off with introducing yourself, double checking with the patient name, date of birth, as mentioned before, and then ask the patient what's going on. The patient will tell you that I feel anxious, I feel chest pain, I feel panic, I feel breathlessness, I feel short of breath for the last, say, for instance, couple of weeks. So you're going to tell them, well, I'm really sorry to hear about this. Can you tell me more about it? How all started? And where about? So you need to find out what's is going on and what could be the underlying issue, basically. So the patient will tell you, I have those feeling of panic attack, bounding, excessive sweating, muttering, feeling anxious, only at the workplace, but when he's or when she's back home, she's perfectly fine. So you might ask, do you have any thoughts? What might be the reason? So the patient will confess to you and say, "Well, doctor, I am in a woman with another woman relationship, and I'm a lesbian. So and I don't feel." And she will tell you that I don't feel comfortable in the workplace. They are bullying me, abusing me, try to make joke of me. So you will say. That's really not acceptable, and you will try to understand the whole symptom that the patient is undergoing. So you can ask, for instance, how does make you feel? How's your mood? Do you have any tingling sensation at all? Do you sleep at night? How's your appetite, for instance? Have you had any thought about harming yourself? This is, of course, going to follow up with the mood question. And then you will ask if there is any support system, like, for instance, a friend, a family who live nearby, who know about your situation, who can understand and talk you through the whole situation. You need also to ask about what's their living situation. So she will tell you, I live with my female partner. So we'll ask, what sort of a relationship are you happy together? How long it all started? And then you can ask the other follow-up questions, which basically past medical history, any medication history, any non-allergy, any non-family history of any disease. Also, you need to ask about lifestyle questions, basically the smoking, the drinking, any physical activity, diet habit. So all of that, after you ask it, you will address to the patient and say that shouldn't be unaccepted. I mean, at the workplace, and you will ask if the patient had raised this with the environment where she works, or if she can speak to the manager, for instance, and try to tackle the issue and see what can be done, basically. And you will offer her also CBT, psychological or a talking therapy, to talk through her feeling, through their emotion. All of that is very important. And also to change the behavior. So, for instance, if she's having breathlessness, so she needs to slow up her breathing and try to do breathing technique to make her calm during the panic attack. And if this all measures did not help, you could offer at the end antidepressant or anything to anti-anxiety or anxiolytic medication to calm her down. And of course, ask the patient if she is happy about the whole things and what can be done for her. Maybe the patient have something in their mind that would like to express, because all of that will affect the mental health issue, basically, for such patient. And of course, this just will, bullying, discriminating, all of that will affect any person mind and mental state. So that's in brief about basically bullying. Another case and concept, and the same concept, is about a patient who's basically lesbian as well, and had a letter inviting for a cervical screening test. This test is done in the UK as a screening test. It's among one of the 5 national screening system in the UK. And this test is basically done for women at certain age to detect any cervical cancer. So basically, the patient will come to you and will be worried and anxious, and she will mention to you, of course, after introducing yourself and ask the patient name and date of birth. She will tell you that, doctor, I received this letter and I don't think I'm the right person to do that. So I need to ask why. Why do you think you shouldn't receive this letter? So she will tell you, basically, doctor, I'm a lesbian and I don't think I need this test. And so you'll tell her this test is basically done for any woman at certain age, which is basically between 25 to 64 in the UK. So it's part of the screening. You tell her, of course, that this test will detect if there is any minimal change in the cervix. And you will tell her that science prove that the virus which is responsible for this, which is called the human papilloma virus, is transmitted, although it's transmitted through heterosexual relationship, but it has been found through the lesbian intercourse as well. So it passed through any body fluid, and this include oral, vaginal fluid, which can be exposed to human papillomavirus. Another factor or risk factor you need to ask about is smoking, because smoking is well known as a strong risk factor for cervical cancer. And also you need to ask about, for instance, the kind of the relationship between these two ladies, and how long they've been in a relationship, and if it's only homo or if it's mixed homo and hetero. You'll ask what means they use, because it's well known certain people, they use sex toy, so you need to inquire about all of that. Also inquire about the period, if it's regular or not, and when was the last menstrual period. You need to ask about sexually transmitted infection, and it's not called sexually transmitted disease anymore, it's called sexually transmitted infection. So if there is any discharge, what's the color of the discharge, if it's smelly at all, if there is any itchiness, if there is any bleeding during sex, for instance, if there is any pain in the lower pelvis, and if she had any cervical screening before, and if she has any relationship before with a man before starting with women. So all of that is very important. Also, you need to ask about any past medical history, if there is any well-known chronic disease, any history of medication, if she's taken any regular medication, any known allergy. And also you need to ask about any known family history health issue. Also about the drinking, the diet is very important as well. And after asking about all of that, you need to inquire, as I say, if it was hetero before and then started to be homo, and if this relationship is stable. And after all of that, you need to comfort the patient that it's part of the routine and there is nothing to worry about, and explain the procedure, what it will involve exactly, and address the patient main concern. And ask her if she's happy to go ahead and have her cervical screening, then after explaining the whole story in regard. I hope by that I covered 2 stations in one, and it's one of the commonest as well cases in lab 2. So that's in short about taking history in chest cases. Thank you.